when properly prescribed and monitored, testosterone replacement therapy can have profound effects on your overall health and quality of life.
Yeah. So the very first thing that I noticed, and most anybody notices, is your energy level. So a lot of people, they, they get in the first few months of treatment, there's, energy, restoring zest of life, and they just feel like they have a new lease on life. And when you have more energy, then, obviously we can, exercise more. You're going to increase, muscle protein synthesis. You'll enhance your muscle recruitment fibers, your recovery time. So greater strength and gains on resistance training. Your muscle to fat ratio is going to improve because you're going to reduce that fat. We can build muscle and reduce fat at the same time. Mental clarity, memory, processing, awareness, decision making. Those are all improved through that as well. And we mentioned the sexual part of it already. But yeah, you're gonna have your wife. Maybe we should target women because men have a phobia when it comes to going to the doctor and getting their blood drawn. If your men are not performing the way they need to be performing, you need to tell them to go get on TRT, because then you're going to thank us. Extra, a serious note, like, man, your women are going to be happier if you can perform, because if you have an erectile dysfunction and you can't perform, the woman will feel like it's a direct reflection of her. She's not going to understand, but if you can go whenever she's ready, then she's going to feel like special in that regard. We specialize in erectile dysfunction as well.
Definitely. So yeah. I think that the other part of that, not only it's going to help in the bedroom, but you're going to have the energy to help around the house. I mean, she's going to appreciate it much more. That's why the other thing is, like, to talk to the women about this, because, is your guy just dead after work and he doesn't really want to, like, help you around the house, or, go outside, pick up leaves in the fall, whatever chores there are to do around the house. This is going to give him that ability and not be so bogged down, which is so crucial.
We talked about that, mental well-being, sleep quality.
Also, women, if your guy has sleep apnea, and he snores, and it sounds like he's sawing logs all night long, testosterone can potentially help with that, because it's going to help trim him down and open up those airways. So all of these benefits are pretty far-reaching, right? And they're pretty impressive, but you can't just magically take testosterone, especially like if you just want to go bonkers and take a crazy dose and just think that all these things are magically going to happen. So that's the crucial component here. It's important to understand that, yes, that stuff's impressive, but it's also very important that it requires proper medical supervision and careful consideration of various factors. So a lot of this is due to your labs, right? We want to make sure that we're watching certain things on your labs, and every person is different. So testosterone can affect people slightly differently, and we want to make sure that all of those are in line to optimize your overall well-being. And that's the important thing here. And you also got to remember that with it being a hormone, this isn't something where you take one shot and you're Superman, right? This is something that's gradual. It takes time for your body to acclimate to the new environment that you're providing by putting testosterone in it. So, so before starting testosterone replacement therapy, there are crucial factors that every patient needs to understand. At My Body Health and Wellness, we believe in full transparency about what this journey entails. So number one, medical screening. This is where the lab work comes into play. Proper screening is non-negotiable for safe and effective treatment. Not only is it a huge liability to, like, a doctor if they're not screening you and doing labs regularly, but it's also dangerous to your health, to be honest with you. So some of the essential labs that you're going to want to draw not just your total testosterone level, but your free level. Don't go, like, any clinic you go into, even if it's not us, if you go into them and ask them what labs they draw to monitor your testosterone, make sure you're very specific and you ask them, do you specifically draw free testosterone, or do you calculate that? That answer is going to tell you what caliber of clinic they are. Because I promise you, that free testosterone panel is not cheap. It's the most expensive panel on this entire set of lab work. So number two, testosterone is one side. What's the other half? Estrogen. So you got to make sure that your estrogen is not spiking. So that's an E2 or an estradiol level. Very, very important. You're going to have your CBC, your complete blood count, your comprehensive metabolic panel. So you can see kind of what's going on with, like, your lipids and cholesterol, your PSA, that's going to be prostate. With that If it gets too elevated, the prostate's being enlarged and you probably don't want to be on testosterone for that. There are things you can take, like we mentioned earlier, that DIM can help reduce that size and make it a lot better. Thyroid function, so that's going to be a metabolic component, and then your lipid panel. And then in terms of physical assessments outside of that, we're going to want to know medical history, right? We're going to want to know body composition analysis potentially to kind of get a baseline level so that we can show you, hey, this is where you started and this is where you're progressing to. Blood pressure is another one. Obviously, if we're monitoring like your hematocrit, which is that blood thickening, which is part of that CBC, it's going to allow us to see if that blood is thickening, which is potentially lethal. Your heart is going to have to work a lot harder to pump your blood if it's significantly thicker. Prostate exams, potentially, we would send you off to a specialist if there is a serious issue there. And then potentially even sleep apnea screening. These are all various factors that if you have an issue with, that you'd want to bring to our attention. There are potential side effects. So TRT requires understanding of these potential side effects. So these are all manageable, but things to consider: mild acne. You can also retain water, so fluid retention. But if you're on with a legitimate medical clinic who's really out to serve your best interests, your dosing is going to be appropriate. And so they're going to make sure that those effects are mitigated. Then obviously the changes in PSA levels, which is prostate related. So strategies on how to manage these: getting regular labs done, and then adjusting that dosage as you need. Maybe you need to go down if you're starting to have PSA spike, or you're starting to get massive amounts of acne and it's not controllable. And then a big part of it is the estrogen side. So we always include in all of our therapies an AI, which is also known as an aromatase inhibitor. That's how you keep that estrogen from spiking. And we can adjust that dosage separately. And the reason being is that way we're able to change each one independently as needed, which in the end gives you guys much higher quality of care, which is what we're all about. And then on the fertility side, implementing some sort of gonadorelin, dimclomiphene mixture, then understanding that all of these are preventable or manageable with proper medical oversight. So we want to understand here that when you go with the clinic, we're going to be safety first approach, because everyone is different. And that value of the medical expertise is honestly second to none.